Academy members. Thrilled to be here with our Voices of Otolaryngology podcast. This session is going to be about advocacy and the Academy. Ironically, we were supposed to record this on December 11th. And what we'll do is when I ask a question, could you just introduce yourself? So, Lance, where were you December 11th? I know where you were. Can you let everybody know what you were doing? Some busy work, and if you could introduce yourself.
Absolutely. Yeah. Lance Manning. I'm the physician payment policy, otherwise known as 3P work group chair. And a number of us came to Washington and actually had a great couple of days on the Hill.
And Lance, where do you practice? Where are you based out of, sir?
Yeah, out of Northwest Arkansas. So in a single specialty private practice right in the middle of the country.
Great. Dr. Scarlett, do you mind introducing yourself? What is your role and how are you going to help us raise some money to advocate?
Sure. I'm Matthew Scarlett. I'm the ENT PAC board chair. And so, yes, we're raising funds so that we can be the boots on the ground to fight for the entire academy.
All right, we're going to launch something pretty soon, right in the new year. Can you tell us what that's called?
It's called the First 50, and we're trying to get $1,000 donors and up in the month of January so that we can then create a budget and hit the ground running with this new congressional session.
Can I be your first of your first 50 right here? Can I pledge?
Well, 1201, January 1st, but yes, I'll write you down.
You won't take it now. I want to be number one. Two is my lucky number. Put me as number 2, Dr. Scarlett.
Understood.
All right. Dr. Rayner, then Dr. Baldessari. Dr. Rayner, can you tell us about yourself and what's your role?
Sure. I'm Eileen Rayner. I am the chair of the Legislative Affairs Committee for the Board of Governors. I practice pediatric otolaryngology at Duke in Durham, North Carolina.
Fantastic. Thank you. And Dr. Baldessari.
Hi, Christina Baldessari. I am currently the chair of the Board of Governors and very excited to be on this podcast because advocacy has been a huge focus for the Board of Governors over the past year or so. So happy to join and share a little bit about what we've been doing.
Great. Dr. Baldessari, maybe at like 20 minutes into it, you'll tell everybody why we have a unique relationship. All right. So I'm giving you 20 minutes to think of a great story. So Dr. Manning, how did you get involved with advocacy? Why did you spend a whole 2 days out of your practice? Why are you committed to it? You spend dozens of hours as a coordinator for advocacy for the Academy. Let's start with why.
Yeah, so advocacy became a focus for me because of its direct impact on both patient care and sustainability of medical practices and issues that we were addressing last week, in fact, like inflationary pressures, particularly rising labor costs and declining Medicare reimbursement rates, basically access issues, barriers to sustainability for our practices. I think they highlight the need for physician voices in shaping healthcare policy. And I think that working together through advocacy, we can lead to better outcomes in our field and for the communities that we serve.
Yeah. One thing I'd like to do on these podcasts is just keep everyone guessing so you don't know where I'm going. Dr. Rayner, what are some of the priorities that you think about within your kind of academy volunteer roles when we think of advocacy, not at Duke per se, not in pediatric otolaryngology?
I think we need to really be united as a house of medicine. We need to have our voices heard. We don't need to be having our stories told by third parties who really just want to have a piece of the pie, so to speak, and cause problems for patient care and access, like was said by Dr. Manning. So we need to be loud and clear about what our needs are for our patients and for our practices, and just really trying to get the best health care for the country that's possible.
Yeah. This is a video cast, and my great friend, Dr. Baldessari, we forgot to tell her. So she's at swim team practice pickup, and I think that's the real life you all live. I mean, you fit these in your day-to-day jobs. I can't be more appreciative, Christina. Christina, what are some of the priorities in your leadership role? And remind the group, Board of Governors, and what are some of the priorities of the group? And then Matt, we're going to help you raise some money there on our behalf, so be ready. Dr. Baldessari.
Yeah, so I mean, the BOG is really looking to kind of engage our members in advocacy. And so we know that, many of you, right, we're all busy. We don't have time, we don't have a lot of time, so why, is advocacy important and how can we get involved? And so that's really what we are focusing on. And so one of the things this year that we're really trying to revamp is the state trackers program. And so state trackers are volunteers, Academy members from, all 50 states that basically look at state legislation as it comes out to see if there's going to be an impact on our patients or our practices. And so we're really looking for more people to get involved. We want a diverse group of physicians from, different practice types. And so that's definitely one of the initiatives that we're focusing on, is really revamping that program, because a lot of what impacts our practices and our patients is legislated on the state level as well. And so having, really kind of, people boots on the ground that are paying attention to this legislation and letting us know what's going on enables us to identify and be proactive instead of retroactive, which is, we don't want to be going backwards and looking at laws that we didn't think were beneficial to our patients. And so that's definitely something that we're focusing on. And then also creating more advocacy education as well is something that BOG is focusing on. A lot of people may not know how to get involved. And so we're trying to get the message out of different ways that we can do that.
Great. Dr. Manning, just before, I'm going to give you a heads up, okay? You're going to have a minute to think about this. When I get to you, Dr. Manning, I'd love for you to articulate what are our priorities, what they have been, because we do kind of want an elevator pitch. Dr. Scarlett, watch this. I'm in my study at home. This is impromptu. Watch this. All right. I wasn't kidding. Right next to my studies, my checkbook. So I'm going to write a check right now for number 2, and I'm going to pledge $5,000 to the ENT PAC. I'm going to write that check and mail it in. Matt, what is the value of that check? Why does the ENT PAC need dollars? I'm serious. Here it is.
Yeah, fantastic. We'll take it. Here, just hand it right in. That's what gets us access, right? So when we want face-to-face time with Congress, hard dollars, hard donations from Academy members, ENT doctors, are what gets us, in front of the congressional people. And, Washington works by support. And so we support both sides of the aisle. We support the people who are advocating for the appropriate bills that we want to support. So that money is necessary in order for us to get in front of the Congress people so that we can tell them what's important and why we need to do it. I will also say, too, the call to actions that we send out cost nothing, and they take very little time. So when we send, hey, there's a call to action, contact your Congress folks, contact your senator, those are so important to do. And they literally take 2 or 3 minutes of your time, and everybody can do that. So please do that as well as write a check.
Yeah, so here it is. I'm covering it up so nobody can take my check. But here it is. All right, Dr. Scarlett, January 2nd. Number 2 is my lucky number. It's done. All right.
Fantastic.
Dr. Manning, I was blown away by the relationships you have. We pre-met on the Wednesday, and you said, yeah, I kind of know some people, and I just laughed. I said, Lance, you're not getting in anywhere. And it was stunning. On Thursday morning, you actually met with your representatives. Can you talk about those relationships that you built over decades, and what are some of the things we advocate for? And then Dr. Rayner, we're going back to you.
Yeah, so some of the things that we're advocating for right now, obviously, there's a pending 2.8% cut because of budget neutrality, and working hard to prevent this. Additionally, our Academy's top priorities include securing increases to the physician fee schedule and hopefully tying that to the Medicare Economic Index, addressing the historically low Medicare conversion factor. We're working to stabilize reimbursement rates through legislative changes and collaborating with bigger specialty medical organizations, working on prior authorization, and then lastly, working to pass extensions of the telehealth flexibilities that we had during COVID. How I got engaged, honestly, I found that in meeting with the staff first of my respective senators and representatives, if you come in there and you really are there and talking about patient care and access in a hopefully a kind and well-framed manner, keeping the patients first and the access first and sustainability of our practices, they'll listen. And so that actually led to setting up some meetings when they came back, when they were out of session. I had one of our congressmen come and actually spend a morning with me in clinic and wanted to meet my staff and understand exactly what we were talking about with regards to the labor challenges we face. And so I get engaged with them when they're back in the state. and have built the relationships. And then when you come to Washington, actually, almost all of them are happy to meet with a constituent that, they know to some degree, and want to hear, with all these items on the table, want to hear what it's like actually in the trenches. So it's simple as that.
Yeah. It's probably your humble, self-effacing confidence. Nobody wanted to meet with me, Lance. I have to surround myself with you all to get in the door. But that's awesome how you build those relationships. Dr. Rayner, it's intimidating. We're not taught this in medical school or residency. Some are natural, like Dr. Manning. What advice do you give to our 15,000 members? Dr. Baldessari saying, get involved with state trackers. Dr. Scarlett saying, look, we understand, if it's not a time pressure, perhaps you think about the PAC. Give us some confidence. Give us some tips. How do you get involved?
So there's a lot of great ways to get involved. Definitely state trackers is one way. Also through the State Otolaryngology Society and the State Medical Society. Those are really good opportunities to get to know your local legislators and have a chance to participate in state level advocacy, which will affect a lot of day-to-day things such as scope of practice issues and things like Medicaid expansion, which our state passed last year finally and added 600,000 patients now to the insured rolls. And then there's lots of opportunities to go up to Capitol Hill. So there's opportunities through our academy, through the AMA. I started this journey not long after residency. I ended up going to my first advocacy conference through the American College of Surgeons, and it was an eye-opening experience. And, you get up there and it's fairly intimidating walking through those halls of Congress, but then you get in there and talk to either the member of Congress or their health aide, and they really want to know what's going on. They care about healthcare. It is a nonpartisan issue. Everyone's affected by it. All the constituents are affected by it. And so really bringing it home with patients' stories of, when you want to kind of talk about whatever the issue is, say prior authorization, and how that really created some hardships for a head and neck cancer patient, for example. So having patient stories really gets those conversations flowing. And so joining in on an advocacy day with other people who have done it is a really good way to kind of get started.
That's what Dr. Manning did with Dr. Dubin and myself. And you reach out to the Academy, and Eileen, we will post that link, right? You reach out to the Academy and they can help facilitate a terrific people like Mara Farrell and Harry DeCabo. Dr. Baldessari, I'll just spill the beans. I was a junior faculty member at Children's National, and Christina was one of my first fellows or second fellows. And the greatest quote she ever gave me, I was giving her some, in hindsight, naive advice on publications. And I said, Christina, you want to publish a lot. And she just looked at me and she said, Rahul, you can publish quantity or quality. And it looks like you've chosen the former. That was awesome. Christina, Board of Governors, what do we do? How do I get involved? You've hit the ground running. We're so thankful for you. And then as you answer that, I want to do roundtable, and I want the four of you to think about what's the one ask for our members that we ask them and how they get involved. But Christina, Board of Governors, give us a platform there.
Yeah, so for the Board of Governors, some people don't even really know what the Board of Governors is, right? So the Board of Governors, it's comprised of basically most of our states have an otolaryngology state society. So the Board of Governors is comprised of each state society and then some of our specialty societies as well. And so anybody can be a member of the Board of Governors and through your state society or through one of the specialty societies. And so like I said, the Board of Governors is really focused on advocacy and getting people involved. And so we talked about state trackers. There's also the IGO program. And so again, if you don't know your legislators and you want to get to meet them, the Academy actually has a program where they can put you in touch and you can do a in-district meeting with your congressperson when you're home. And again, you don't need to have any prior education. It's not intimidating. Our Academy will do all that for you. And so there's so many different ways that we can get involved. And again, the Board of Governors is really going to be, over the next year, pushing out information about different ways, things that appeal to you, whether it be state trackers, whether it be advocacy on a federal level, whether it be more regulatory advocacy. When I was the chair of the sleep committee, advocacy also extends to things like talking about, payers requiring patients all of a sudden to have an oral appliance before they get sleep surgery. Well, many, patients aren't a candidate. And so our academy, through advocacy is also advocating on behalf of our patients to payers as well. And so getting involved through committees is another great way.
Yeah, thank you. Now everybody knows why you and I get along so well, because it's always a rush to see who can speak faster. That's how we get along well. Dr. Scarlett, the ENT PAC, this is a leading question. It's got to be partisan. I can't imagine we're nonpartisan. I mean, some people represent our interests better. Can you convince me you're partisan?
We're not partisan. 2024, I think, because there was a little bit more Republican leadership, especially more physicians. I think we were 52% donations to Republicans and 48% to Democrats. We really shoot for 50-50.
Yeah, and so what do we contribute? Do we contribute cause? Do we contribute people? How do you all think about it? And can you talk about how much money we've raised, or is that something that's at your fingertips? It's on mine if it's not on yours.
Yeah, so I mean, we focus on the people who are supporting our causes. A lot of those folks are the doc caucus. I mean, there's a good number of doctors on both sides of the aisle, both in the House and the Senate, and those people really kind of get what we're coming from, because they've worked in the trenches and they know, and so they're fantastic advocates for healthcare reform. And so those are people we focus on. And then there are co-sponsors of those bills, and if they're consistent, then we give them money as well. I think we hit 360 donors and 160,000. Is that the number you have? Yeah.
Yeah. I like your number. It's a bit higher, but it gives a ballpark on how our members contribute, and we do have the first 50 campaign. Eileen, tell us about Otoforum. It's something that you are very passionate about, and it's hugely important. Eileen.
Yes, so please plan on coming to Otoforum in April. It's the weekend of April 25th in Alexandria, Virginia. We're going to have some really great advocacy events there. We have a really good panel about physician input into the payer side of things, with involvement in Medicare and Medicaid and Blue Cross. So it's going to be a great event. And so I encourage people to really sign up early.
But Eileen, it's not for you. You're a Duke. You're in an academic practice. Isn't the Otoforum for private practice?
It affects everybody, and you'll learn something from everybody. And so it's just a great experience to be there, because issues that affect private practice affect everybody in any sort of an employment setting. And even if you don't necessarily see it directly, you definitely will see it indirectly. So you get to learn a lot, and it's really worth it.
Dr. Manning, does our advocacy make a difference? I was really impressed by the ability for us to get in the rooms and have really meaningful discussions. I mean, we spent a whole day there. We had hours of meaningful discussions.
Unfortunately, too few people have those discussions. So when you show up to have the discussions, they're going to listen. And fortunately, we still have a very well-respected specialty and profession, and they want to hear from us. A lot of these issues are not things that they have lived or have any access to. So I think obviously advocacy is essential, because it shapes the policies that affect our practice sustainability, our reimbursement, and patient care access. And even small steps, I think, can lead to fulfilling career-long involvement that strengthens both our practices and our entire specialty. And my one ask, and I think this is the ask of all of us, and it's fair, I think we have to show our legislators that we care. Even if it's a small donation to the PAC, it's responding to legislative alerts, or just having a conversation that is going to be impactful. We've got to show them that we actually care about our issues, and we care about our patients, and we care about the sustainability of our practices if we're going to ask them to.
So Lance, I'm a shy guy, and I'm sitting there with the staffer who sometimes might be half my age. I get intimidated. What do they actually want to know with it? What happens in those conference rooms? Do they ask me about diagnoses or anatomy? Do they ask me about house resolutions? What do they want from us? Tell them what happens in the room.
Yeah, so I mean, first I just want to hear about you and your practice, and typically we talk about things that are common in our state, and very often they're very familiar with your locale. And so there's a little bit of getting to know you. And then at that point, they just want to know, hey, how are these issues actually impacting your practice? And how are they actually impacting your patients? And how long does it take to get in? And how many patients are you seeing? And how are you doing with regards to, the cost of business? And how hard is it for you to hire staff, and what does that mean to your patients? They're simple questions that we all know. And I think that they want to know that these things that we're asking them to go to bat for, and a lot of it comes down to appropriations that we're asking them to help sign checks for, that they're needed and that they're going to be meaningful in the community.
Yeah, Lance, and Dr. Baldessari, I'll start with you as we start doing a round robin and end up, because I know swim team practice ends soon, or it might have ended. So we got you. Dr. Manning, I remember, you might have been in the room where we spoke to a staffer in a state west of the Mississippi, and they actually talked about their grandmother and said, if my grandmother drives 2 hours to the doctor and then goes home and needs a prior auth, it's really hard for her to come back. And that's all the discussion was, Lance. We weren't talking about an otologic condition. We weren't talking about intricacies of House resolutions. They just wanted to hear the physician's perspective on why prior auths matter. Isn't that right? Do you remember that, Lance, that discussion?
Absolutely.
Yeah, it's really, they just want to hear our voices. So let's start with Christina, Eileen, Matt, and then Lance is going to explain to us at the end what 3P really is, because I can never remember the acronym. So Christina, let me ask this, and I'm going to read my quote here. If there's one thing you could ask each member to do that has a measurable impact on advocacy, one thing, and then I'm going to have you hop off, Dr. Baldessari. You're so kind to spend your evening with us. So Dr. Baldessari, one thing.
Yeah, so I would say get involved with your state society. From a BOG standpoint, I think become a member of your state society because that is really a great way to know exactly what's going on from an advocacy standpoint. So join your state society.
All right, let me be very clear. So how do I do it? Let's say I'm in Oklahoma. What do I actually do? I'm listening to this podcast. I'm excited. How do I join my Oklahoma State Society?
Yeah, so if you go to the Board of Governors website, we actually have a map that's right there on the front, and you'll be able to click on your state, and it will list your Board of Governors representative, if there's an administrator, and so you can, from that map, contact them directly, and you should be able to join your state society just like that.
Awesome. You know what I think we'll do? We'll talk to our internal team, Miguel Ventura and Christopher Harris, and maybe we can have a 30-second video on how to do that, because I just don't want to intimidate people. Dr. Baldessari, whatever you have to do, please do it. Thank you for jumping on board with us here. Dr. Rayner, Dr. Scarlett, then Lance is going to unveil what the REP stands for. Dr. Rayner.
I don't want to steal Dr. Scarlett's thunder, but joining the PAC, we really need people involved. We need numbers and percentages. And the percent of otolaryngologists that are involved in the PAC is abysmally low. The percent of physicians that are in
2%, Dr. Rayner, about 2%.
Yes, abysmal.
Yes, ma'am.
If you look at other areas like lawyers, like the nurses, they're in the 90% range. And legislatures look at that. They don't necessarily care if you donate $100 or $5,000, but they do look at what is the percentage of the body. Are we representing the whole specialty? 2%, it's hard to say we're representing the whole specialty. 90%, we can confidently say we're representing our specialty. So please think about that. It's really important and it makes a difference.
Yeah. Awesome. Dr. Baldessari, you turned the proverbial light on. Did you want to jump in there with a comment?
No, I agree. I mean, it's 2% is just, when I heard that number the first time, my heart, it's such an important thing. And, I really think that we can do better. We need to support our PAC so that we can advocate for our patients and sustain our practices. So I couldn't agree with Eileen more, and it's so easy to do. So I really would love to see, the BOG is really, our committees have really made a commitment to try to donate, and I'd love to see all members, kind of donate to support it.
Yeah, and there's the monetary impact, which helps, but it's actually strength in numbers. And
Right.
if you yourself don't want to be listed on the federal election forms, or you have a spouse or significant other, or where you live, you donate less than $200, you're not listed. And so it's really the numbers that matter. When we go, and I talk to legislators with Dr. Manning, Mara Farrell, Harry DeCabo, and they say, how many members do you represent? I say 15,000. I'm proud of that. And then they say, well, how many in your PAC? And then I just walk out, because 2% doesn't help us put our finger on that scale. We don't need to be at 90, but Dr. Rayner's setting the bar high for us. Let's just keep moving up. Dr.
That's right.
Scarlett, then Dr. Manning.
So yeah, I mean, we need the funds, absolutely, and we need the percentages. So yeah, if you can take the pack out to dinner, skip a dinner, give us the funds. I mean, that's a small sacrifice. And then two, there's always opportunities to come to the Hill. I mean, we'll take your time, we'll take your sweat in addition to your funds. So there's plenty of opportunities to come to the Hill in advocacy, and then you can do it in your states as well. But
All
yeah,
right, so in this 30 minutes, you've only asked for two things before we go to Dr. Manning. Dr. Baldessari told me to get involved at the state level. Eileen and Matt have joined forces with the ENT PAC. Lance, I'm a member. I'm intimidated about advocacy. I have two asks. Are you going to give me a third one, or are you going to take one of the top two?
No, I would just reflect back to just showing that you care through one of those activities. It really does. That's the only way that they know. You know, when a very small percentage of people join the pack, they're like, do you care, about the policies that we're shaping here? And obviously we do. We need to take a couple of minutes or a couple of dollars and show that.
Yeah, Dr. Manning's very special, personally to me, but also to the Academy. I know your meetings are about 2 hours a week. You meet with us every Monday for an hour. I enjoy it. You might not. Then you spend other time behind the scenes. Can you tell us what 3P is? We hear 3PPP. We hear it. Just what does it mean for the member? It's a tremendous work stream behind the scenes that doesn't get glory.
Yeah, so it's a group of less than 15 frequently Academy leaders. And basically everything that has to do with physician payment policy comes through there, whether it be a position statement, consensus statement, whether it's something to do with a private payer, or it's a legislative issue or scope of practice issue, new technology that we're trying to get CPT codes, getting reimbursement through fighting at the AMA RUC panel for our patients and our members, trying to get the best possible valuation. So all of those things affect physician payment policy, and the 3P physician payment policy work group are the advocates for those. And I'll say that that work group is a very active work group, and want to thank all of the members that serve on there.
I want to thank you for being a part of it and your equanimity. Could you imagine if I was leading that group, Lance? It'd be all over the place. There'd be several more P's to it. So thank you for the calmness. And I'm so struck when I talk to Lance and those members, you always ask, are we hurting members? And actually, that's fundamental, right? It's easy just to approve stuff, but when you flip it the other way and say, are we protecting our members and our patients and doing the right thing? So kudos to you all. I'm going to pause and I want you to just jump in where you want. This was Advocacy in the Academy. I think we've made the pitch. It's a late evening for you all. What am I missing in your work streams, in your passion, in your home areas? We don't have to have anything. We can be done, but I want to give anybody a chance.
Project 535. So what that is being a key contact for your national representatives in the House and in the Senate. That's where a lot of those letters come through for the Academy to jump on to a sign-on letter or something like that, advocating for getting rid of these Medicaid or Medicare cuts and things like that. And if you can serve as a key contact for your national representative and get a chance to get to know them and their health aid, it really makes a difference when you walk in their office and you see them and you talk to them and they'll remember you. So that's another great Academy way to get involved.
I did not get past the front desk. Lance on Thursday met with the representatives. So that connection's huge. And Lance, I never knew you actually invited them to your office. I've never been invited to your office, so I guess I've got to run to Congress first. Eileen, how do I get involved with 535? And we'll put a link with this podcast, but just a little bit more detail for a member.
Yeah, so there's actually a link on the Academy website to sign up, and you just sign up as a key contact for your state, and it links in. You'll enter your zip code. It'll tell you who your House representatives are and who the two state senators are, and then you can also sign up for GovHawk, which is it's an emailed legislative kind of information thing talking about what's happening nationally, what's happening locally in your state as well.
Yeah. It's really amazing the resources we have for members. I bet you, I'm gonna put you all four on the spot. Can an Academy member just email you if they're nervous? You all four are the nicest folks. I'm sure you would talk to a member for 15, 20 minutes and assuage their fears of advocacy. Christina, you came off mute, please.
Yeah, so I mean, I think, for me, this topic is so important. For many years, I said, I'm too busy. I have my practice. I have my family. This doesn't impact me. Other people are doing this. And it turns out that that's not the case, right? If we are not advocating for our patients and our practices, then, we are allowing legislators and people that don't know about what we're going through to make laws that, can negatively impact us. So I really implore people to take the time. This is so important. And every little bit helps, whether it be donating to the PAC, whether it be answering, the calls, to contact your senator. Those calls, that we mentioned are a single click. All you need to do is click contact my congressman. It comes up for you. You type your name in the bottom, you hit send. It takes 10 seconds and it does make a difference. Every time I send one of those, I got a letter from my congressperson saying, we received your reply. And so, they know that you are engaged. So even the small things, but my ask is just whatever way you can. We talked about a bunch of different ways. Please get involved because it is so important. We can no longer just, afford to just say, oh, we're going to let somebody else do this. We all have to be involved.
Yeah, and I think that's why you and I are buddies, Christina. We share that passion. I'm 49 years old, and I ran to this academy job because I'm just sick of us not having that platform. And so I want to fight every day in and out for our patients. And we have great members like you all that join me on that. Matt or Lance, anything to add? Matt, you want to go? Then Lance, you bring us home, Matt?
Yeah, I would say, if you feel frustrated by prior authorizations and denials of care, if you feel frustrated by staring in the face of cuts every year and your overhead's going up, this is how you make those changes. You can't just, complain to your staff or your coworkers. You've got to, do something about it. And this is how you do it.
So Matt, and then Lance, I'll let you land this plane. Matt, so I could spend maybe 20 to 30 minutes as a member a month. Is that reasonable or is that not enough?
That's plenty. Yeah. In fact, sending these emails and things like that are really quick.
They're automated, Matt. I push a button
right.
and it happens.
That's right.
It's not that hard. So Lance, you're a pilot also. Don't worry. I'm not, I can be your broker, but why don't you land this plane for us? Bring us home this evening.
For sure. Our academy relies on the passion and dedication of its physician volunteers. So thank you all, honestly, for what you've done and continue to do. They're the engine that drives the academy's support for our field, helping ensure that otolaryngologists have the resources and the advocacy needed to thrive and provide exceptional care on an ongoing basis. And engaging with our academy, with advocacy in particular, enables you to advance these efforts for the good of everyone.
Hey, Lance, you'll see where I'm going with this as I end it. When you're on an airplane and they push you out of the gate with that big thing, what is that thing called that pushes a plane back?
Tractor.
Okay, so you're the pilot, Lance. We're all your passengers, and the academy's your tractor. We're just pushing you back. You all are the flyers, and we're here to serve you all. Thank you all very much for taking times out of your really busy schedule to join us on the video cast. Christina, next time we enlist people, we'll tell them it's a video cast. You're cool. Thank you all very much. Thank you for what you do.